Self-diagnosis is basically diagnosing your own illness or condition without consultation from a medical professional. The internet has kind of changed the landscape of modern healthcare, and so the availability of information online, the widespread access that people have to it, the anonymity, all of those make searching for health information online something that can be a very positive, empowering, educational experience. So the amount of information available, the sheer volume, is quite intimidating. None of it's regulated. The veracity of the information online is highly questionable, and the ability of the typical online health information seeker to wade through that and determine what's responsible and what's credible is very limited. Some of the benefits of using the internet to seek out health information or to self-diagnose, for lack of a better term, is you can save time, you can save money, you can save yourself a lot of stress. The drawbacks also have a lot of crossover. Misdiagnosing yourself using information from the internet can generate a lot of uncertainty, a lot of anxiety, a lot of stress, and more seriously, potentially short or even long-term health consequences with mistreatment. These are a lot of typical healthcare provider concerns where people go online, find information for something that they think they have, and what they're doing is actually further damage or harm to themselves because they're treating it incorrectly or using something they shouldn't be using, or something that might be healthy for one person but very harmful to the next because of the condition that they have. Now, patients who go online and don't talk to their doctor about it are not being forthcoming. They're not giving their doctor the complete picture of the kind of field of experience or frame of reference that they're coming from when they walk into the exam room. It's really important to talk to your provider. Let them know what information you're finding, where you're finding it, and how you may or may not be using it. So we have to be careful and find a middle ground. So we're using these resources as education and support, but not using these resources to self-diagnose. Cyberchondria is essentially an unfounded fear or heightened concern of a serious medical condition based on the review of web content. Cyberchondria has a lot more crossover with problematic internet use than traditional hypochondria, a compulsive online behavior similar to shopping or gambling. Cyberchondria should be treated, I think, and understood more in that framework as it's a problematic online behavior versus a medical condition like hypochondria. Hypochondria is quite rare. Cyberchondria, I think, is a lot more common, a lot more diffuse, a lot more manageable, and definitely a product of our society and culture becoming more internet savvy. The first place you should be going as a typical patient or online health information seeker is go talk to your doctor. Open up the lines of communication with your providers, because if they're not interested in funneling you to credible online health information, then find another physician or provider. Hopefully, doctors will be receptive to that information and try to funnel you to places online that are going to give you credible, responsible information. The internet is here to stay, and there is pretty much no way you're going to be able to keep your patients off the internet. They are going to go online, they are going to research information, so it's best to find a way to work in partnership with them to get them to the right information. My first line of defense would always be to talk to my doctor or nurse or provider and say, where would you recommend I go? The CDC, the Centers for Disease Control, or Medline Plus, which I believe is being funneled from WebMD. I think we're already starting to see substantial advancements in that area. People are generating websites and tools and apps that are being constructed with the input of physicians and providers. And instead of giving someone a diagnosis, it gives them a list of questions or prompts that they can ask their doctor when they're talking to them about their health concerns. It's important for a responsible patient to always err on the side of caution. If you're looking online, that's okay. The internet is a great educational resource, but it is not for diagnosing. So always use the internet as kind of a supplemental tool to educate yourself. The diagnosing should be left to the professionals.